Can ear infections cause hearing loss in your ears? Imagine feeling a fullness in your ear or hearing muffled sounds. That could be more than just a temporary inconvenience. Ear infections are quite common and can sometimes impact your hearing. To understand how, let's explore what happens during an ear infection and how it might affect your ability to hear clearly. Ear infections, especially those affecting the middle ear, known as otitis media, often cause temporary hearing problems. When an infection occurs, fluid can build up behind the eardrum. This fluid acts like a barrier, preventing sound waves from traveling properly through the ear. As a result, sounds may seem quieter or muffled, which is called conductive hearing loss. This type of hearing loss is usually temporary because, once the infection clears and the fluid drains, hearing often returns to normal. Most ear infections that cause hearing issues are mild and resolve on their own or with treatment. However, if infections happen frequently or are severe, they can sometimes cause lasting damage. For example, repeated infections can damage the eardrum or the tiny bones in the middle ear, leading to permanent conductive hearing loss. In rare cases, if the infection spreads to the inner ear, it can cause sensorineural hearing loss, which involves nerve damage and is usually permanent. Signs that an ear infection might be affecting your hearing include muffled sounds, a feeling of fullness, ear pain, or fluid drainage. Children might tug at their ears or seem less responsive to sounds. Dizziness or balance issues can also occur if the inner ear is involved. If you notice these symptoms, it's important to see a healthcare professional, preferably an ear, nose, and throat specialist. They can perform hearing tests and examine your ear to determine the cause. Treatment depends on the severity of the infection. Many infections improve with time, but antibiotics may be necessary if bacteria are involved. If fluid persists and causes ongoing hearing problems, doctors might recommend procedures like inserting ear tubes to help drain the fluid and restore hearing. It's worth noting that most hearing loss from ear infections is reversible once the infection is treated and the fluid drains. However, if infections are left untreated or happen repeatedly, they can lead to long-term issues. These might include persistent hearing loss, speech delays in children, or more serious complications like infections spreading to nearby bones or even the brain. Preventing ear infections is key. Good hygiene, managing allergies, avoiding tobacco smoke, and keeping up with vaccinations such as the pneumococcal vaccine and flu shots can lower your risk. Regular checkups are also important if you or your child experience frequent ear problems. If you experience sudden or severe hearing loss, ear pain, drainage, or dizziness, seek medical help promptly. Early treatment can prevent long-lasting damage and help protect your hearing health. Remember, everyone's experience with ear infections can be different, so personalized advice from a healthcare professional is always the best course. Protecting your hearing starts with understanding the risks and knowing when to get help.